We are live. It's John Baxter Live. We've got an exciting show today. Welcome and thank you for joining. We've got a 30-year UCLA School of Medicine professor who created the future beyond supplements. It's pretty amazing. And you got to watch this. We're going to cover a couple topics today: pain, we're going to talk about sleep, and we're going to talk about obesity. So these are three major topics that need to be addressed, and who is offering some technology influence, helping people with just sleep issues, pain issues, and obesity. This runs rampant in our society, and sleep is oftentimes one of the culprits, right? So if you're not getting good sleep, you're more stressed out, you're eating late at night, possibly you're becoming more obese, and pain starts setting in, become docile, more pain. So it's a trifecta of just issues that are going on, that are prevalent in society, that someone needs to address. I'd like to bring it back to my sponsor, Anti-Aging Bed, and all the technologies that they're doing to reduce inflammation, get a better night's sleep, help you regenerate on the cellular level, and not only that, bring it into grounding, far infrared, antimicrobial, EMF shielding. Some of these things, if you're not familiar with, keep watching my show. Each and every time you get a little tidbit of information. Rome wasn't built in a day. A lot of us want to learn as much as possible. That's why I have this show, so you at home can hear more about all the interesting things that are coming to market. And in regards to that, not only focusing on, I say sleep as a supplement, but we're not dogging any types of supplements out there, in regards to sleep. You're going to spend a third of your life there already. Why not maximize the time? And as we have is, what we have as far as supplements, we have magnesium, which helps you get a good night's sleep, glutathione, and NAC. So we don't carry a lot of supplements, and it's just one of those things that we're getting more into this philosophy. So we have an anti-aging bed philosophy here that we are kind of well known for at this point. This is taking your body and your cellular resonance to a higher level, a higher frequency, feeling better, eating better in regards to your own health, sleeping better, doing all the things you can do for free, get your grounding, get your sunlight, get more oxygen, spend more times outdoors, shield yourself from EMFs. These are all little things that if you're really interested in improving your health, improving your quality of life, that's what this show is about. Technologies at a high level, and for you at home to get some more information about what's going on in the world. I've been very grateful and fortunate, the position I'm in, with working with many doctors as an inventor, and I've gotten to meet some really amazing people. So on this show, stick around. Here shortly, we're going to talk to Dr. Mike Sinel. Like I said, the 30-year professor that has changed his whole, coming from being a professor into taking all this knowledge and transforming the way people are taking not supplements, but something far superior. So, real quick here, what we've got is some more intros. We had a very successful biohacking congress this weekend in Miami. It was amazing, amazing people. Just can't speak highly enough. At the event, Anti-Aging Bed, we are one of the exhibitors, and it was just amazing to be around these like-minded people, spending quality time at the expo and outside the expo. people like me and you that had health problems turned to the different medical establishments, for whatever reason, found themselves in a place where they had to take their health in their own hands. So when you have that type of connection with people of like-minded attitude, it really puts just the rubber to the road in regards to this movement of health, science, technology, and no longer are we getting inundated and indoctrinated with things that appear not to really help us. I'm not going to point fingers. It's not worth the energy, but we all know what we're talking about, right? So, also with Dr. Mike, that's going to jump on the show here momentarily. Not only was he, a professor at UCLA School of Medicine, he has tied in the holistic approach for the mind-body connection. So not only did he have all this influence in academia and medicine, right? He's taken a different approach, and that's what it requires in today's day and age. People that have a passion, that see an improvement, that don't give up, entrepreneurs bringing health technology to you, right? And who wants to suffer with pain? Who wants to have sleep issues? And who wants obesity, right? I haven't met one person that wants one or all three of those, right? Unfortunately, this stuff occurs, but getting the right information is key. It's the precedent. Getting the right information oftentimes leads to a quicker and easier route for success, so that you're actually seeing the benefit. So when we bring it back to this philosophy, right, of anti-aging bed, the theory of aging, going back to this philosophy of layering technologies, I am so excited and honored to have Dr. Mike Sinel on the show today, and I'm going to go ahead and bring him on. So let me go ahead and bring Dr. Mike on. Here he is. Here he is. How you doing, Dr. Mike?
Great. Thanks for having me, John. Good to see you.
Well, let me ask you, just before we begin, I'd just like to ask, what have you been up to lately?
Well, I went to a biohacking congress in Miami, and that was tremendous. As a biohacker myself, excited to see all the evolutions of technology and people taking responsibility into their own hands. Got to be by the anti-aging bed and a number of other things that I think are going to definitely help lots of people in lots of ways.
Awesome. Well, just so that our listeners know a little bit more about you, I'm trying to give you the proper introduction, but I'd rather hear it from you. Go ahead and give us some of the background story of where you started and how you got here.
Sure. Yeah. Well, started in New York City. So I went to undergraduate and medical school in New York City, and did my residency training there at New York Hospital, Cornell Medical Center, and Sloan Kettering. Prestigious institutions. Right from the beginning, I specialized in physical medicine, rehabilitation, and pain management. Was always interested in the mind-body connection. In undergraduate, I majored in psychology, always saw the interface of stress and disease, as many of us know. So after finishing my training in New York at Cornell, New York Hospital, I went out to Los Angeles to Cedars-Sinai Medical Center. I actually ran a department there for a while in the outpatient physical medicine, dealing with lots of different problems, musculoskeletal pain, many rehabilitation issues. And at that time, I had a mentor actually back in New York, John Sarno, who was a really world prominent doctor who was the first one to be an outspoken Western trained doctor, brought up the relationship of stress and back pain. And he sort of called out a lot of the medical profession, saying, look, a lot a lot of chronic pain is stress related. And, you know, I got to study under him. It was very exciting. When I went out to Los Angeles, I brought a lot of that work out there relative to the mind-body connection. I was fortunate at Cedars-Sinai to run a department, ended up with a practice in Beverly Hills, part of a large spine institute doing pain management, rehabilitation, and really, although a lot of my partners were top spine surgeons, my goal was to really keep people out of spine surgery, you know, have them rehabilitate in more holistic ways whenever possible, have them change their lifestyle, have them address all the issues that may contribute to chronic pain, and also a lot of the issues whereby stress and pain were sort of in a vicious cycle. So at that time, I became a clinic assistant professor at UCLA, had 30 years there. And, you know, I was honored to teach in a prominent med school like UCLA. I actually saw, though, that a lot of the students themselves going through a system like that, it's highly stressful and very challenging. So I brought the things I was bringing into my own lifestyle once I got out to Los Angeles. I got deep into yoga, I got deep into meditation, and I ended up having the honor of bringing yoga therapy into the medical school as a course at UCLA, and mindfulness meditation as well. So, you know, really teaching in the medical school about how these things are tools that everyone could use for overall health and wellness and vibrancy, and then especially turning on the medical students themselves who are, you know, in their 20s typically at a very stressful, intense time in their life, having tools for themselves to learn meditation, learn yoga, and see how they can enhance their health. So had a long-term practice in Los Angeles, ended up having quite a number of clinics. And many of the clinics I had always were integrated clinics. So we'd have chiropractors, physical therapists, psychologists, exercise physiologists, acupuncturists. So it was always about taking a more holistic approach to the individual, considering their whole life, bringing in whatever we can. And although clearly, you know, I wrote prescriptions, I was trained typical Western, I was always looking for, you know, what could be offered alternatively that was safe. And I got to learn a lot from my patients. And that brought me to what we're going to speak about today, which is super exciting, which is natural targeted nutrition in the form of these encapsulated medical foods as an option to help combat many, many diseases.
Beautiful, beautiful. That is just an astounding bio, and you know, coming from spinal, like being a spinal expert, that is so beneficial. Let me ask you a question about that. Is a supple spine a sign of a healthy body?
Well, sure. Certainly one of the signs. It's great to have a supple spine, right? People, as they get immobile, and unfortunately, some people, you know, don't pay attention to exercise. And even later in life, 70s, 80s, 90s, we're showing now that people could still improve their mobility, you know, and their spinal range of motion. And that certainly correlates well with health. And movement is medicine, just like food is. Food is medicine, movement is medicine.
So let me ask you, what is the definition of a medical food? Because, you know, yeah, let's go over that first, because I'm learning as we go, and I've learned a couple times already.
Yeah, thank you for that question, John, because interestingly, I was practicing medicine, teaching at a prominent med school, and I didn't know myself when I first got introduced to them. I'm like, well, like most people, I heard of pharmaceuticals, and I heard of supplements, because everyone knows supplements and everyone knows pharmaceuticals, whether they're prescription or over the counter. We all know what pharma is. You know, the synthetic molecules, they have chemicals, they have lots of side effects. You know, we all know supplements, but medical foods are this interesting category that's actually FDA regulated. And I'll give you the FDA definition. So I'll give you the technical definition initially, and then try to circle around and put it in perspective. So the FDA defines a medical food. There's sort of four aspects to it. All the ingredients have to be, they fall into a category called GRAS, G-R-A-S, which means generally recognized as safe. So, which is great because that means these are natural elements like vitamins, minerals, amino acids, so this is the category generally recognized safe. Unlike pharmaceuticals, they're not new chemical entities created in a lab, right? Found naturally. So that's criteria number one. The ingredients are generally recognized as safe. The manufacturing has to be certified GMP, which is good manufacturing practices. So that's a high threshold of manufacturing, like pharmaceutical grade manufacturing, because one of the challenges in a lot of the supplement industry is the FDA doesn't regulate the manufacturing. So people, not to say there aren't a lot of good supplement companies out there, but many of them have manufacturing that is subpar, and you can't actually guarantee that what they say is in the bottle is in the bottle. So GMP, certified GMP manufacturing is the second category. The third category is requires physician supervision. Now, this is an interesting one because at this point, the FDA has apparently been sort of in a bit of a gray area with what that means, because you seemingly, you have to put it on the label, requires physician supervision here, right? And people should tell their doctor they're on one of these nutritional medical foods, but it's because we're treating specific diseases with medical foods, right? And the medical foods are allowed to make claims. So that brings me to what's excited about the fourth criteria. So the fourth criteria is you have to prove scientifically that you're meeting a nutrient demand in a specific disease state, or a nutrient deficiency in a specific disease state that cannot be met through a normal diet. So I want to simplify that and paint a picture. We all have to have a basic level of nutrition in our bodies that if it's optimized at a cellular levels, our bodies will run well. And we all know that our bodies are the most natural grading healing mechanism, right? But when they're off nutritionally, I mean, it's been proven, you eat McDonald's all day, every day, you're going to get sick, right? Because you're not balanced right at a cellular level in the nutrient requirements. So it turns out in most diseases, there are different nutrient requirements if you have a disease. We'll take chronic pain for an example, right? It's like, a way to think of it is like if you think of a car running on the highway at 50 miles an hour using gas of 55 or 60, it's very efficient, right? But if it starts going up a big hill, it has a bigger demand. So it churns up more gas, right? Or I have an electric car, it eats up a lot more electricity going up the hill when I'm going flat, right? So it's like the body's like that. The nutritional demands of the body are increased in a disease state, right? Because it's like a car going uphill. So if you're in chronic pain and you're inflamed, chronic pain and inflammation, your nutrient demands, specifically of neurotransmitters, are increased. And we find that they're deficient in most people with chronic pain and inflammation. I'm going to use chronic pain and inflammation, and we could talk about sleep and obesity, but chronic pain and inflammation is so prevalent, as is sleep difficulties, that when your neurotransmitters are deficient, the neurotransmitters are the signaling molecules of the nervous system. And your nervous system, some level, controls everything, right? We have our spinal cord and our brain and how we feel. So neurotransmitters are the signaling molecules, and they regulate everything. And they're the communicators through the nerves in the nervous system. And they'll signal like hormones to perform through the endocrine system. So if your neurotransmitter levels are deficient and out of balance, your whole body will be off. And it turns out in chronic pain and inflammation, there's a deficiency of a number of neurotransmitters, right? Like GABA, like serotonin, like tryptophan. You've all heard of all of these, right? So what we have proved in the category of medical foods is that we're going to meet the nutrient demand in these disease states by balancing the neurotransmitter levels, bringing the body back to a balanced nutrient state at a cellular level so that it could go into a natural state of healing in chronic pain. and therefore the pain signaling through the nervous system will get dampened, and the inflammation will be reduced because the neurotransmitter levels are optimized. And the medical foods we're going to talk about do that by producing these neurotransmitters, providing the appropriate amino acid technologies, amino acid precursors through a certain technology to balance the deficient neurotransmitters. So this is true in chronic pain and inflammation. It's true in chronic sleep disorders. It's true in obesity. We have problems in obesity with appetite, and these can actually suppress the appetite because, as you can imagine, the appetite itself is very related to your state of mind and your stress level. And, people eat to calm their mood. So you often have decreased serotonin levels, and then you'll eat because it'll maybe produce some dopamine or serotonin. You'll feel better, but then it'll go into a vicious cycle. So that's true with obesity. It's true with chronic pain. It's true with chronic sleep.
Yeah. So Dr. Mike, let's bring it back a step. So let me get to see if I got it right here. So a medical food is a category of natural supplements that are proven, then they have, and you can make a medical claim, unlike a supplement, unlike some pharmaceuticals. Is that correct?
Yes, well, certainly unlike a supplement, right? So supplements are unable to make a claim that they treat a disease. You can't say you have a supplement, like whatever it might be, glucosamine, or like, let's say you're talking sleep and you're talking about melatonin. You can't say melatonin for the treatment of sleep disorders or insomnia. A medical food, because you've proven scientifically you're providing the proper nutrients in the disease, you can make a claim for the nutritional management of the treatment of insomnia or a sleep disorder, for the nutritional management or dietary management of chronic pain and inflammation. So medical foods are in an FDA regulated category that allows them to make a disease claim for treatment, nutritional treatment, natural treatment, because you've proven scientifically you're meeting a nutrient deficiency in a disease state and you're bringing the body back into balance. They also, pharmaceuticals, obviously, that's the whole thing with pharmaceuticals. They can make disease claims, but these are chemical entities that always pretty much have side effects. And some of those side effects might be very horrible and result in many problems for much of the population. They also have drug interactions. Many of them have drug interactions. The medical foods, for the most part, have no drug interactions because they're natural. I mean, very rare exceptions. Pretty much no side effects, maybe a bit of a dry mouth, maybe a bit of nausea, but they're natural substances. And the ones I'm here to talk to you about basically have they're made of amino acids and certain herbs. And they've been out there with 40 million plus doses with no real adverse side effects reported.
So basically what I'm hearing is, there's three basic categories. There's supplements, which almost everyone here is familiar with. The reason why they can't make medical claims is that you can't prove it. Pharmaceuticals are allowed to have claims as they can prove it. And medical foods appears to be the next wave of just technology that can assist humanity, assist the person that needs it much more than running toward our favorite white coat situation, a pharmaceutical, right? So proven claim regardless, it appears that, if a pharmaceutical can make a claim and they can prove that this is actually going to work, or this claim is a conclusion to using your product. So, and for medical foods, it appears it has that same weight as a pharmaceutical, but it's natural. Is
Yes.
that what I'm hearing?
And the other aspect, yes. So it's natural. That's the big difference from a pharmaceutical, that it doesn't have side effects that are dangerous. That's the big deal. I mean, we could take the most common pharmaceuticals in the world for like pain and inflammation. You all know ibuprofen. in the form of Advil, right? Or Motrin, right? Um, I mean, they may work to stop pain, but many, many, many millions of people have significant problems with side effects, gastrointestinal problems, bleeding ulcers, cardiac problems, bleeding problems, renal problems. These are really problematic. Now there's studies saying they may even be bad for chronic pain. So that we have in these medical foods, you have natural substances in the form of amino acids and herbs that have double-blind clinical published studies. I mean, with human data and safety data published in medical journals with natural medications here, taking a nutritional natural approach to the disease without the side effects. And the human trials are actually directly studied against the most common anti-inflammatories in the pain one, which are ibuprofen and naproxen. The published studies in Theramine, which is the medical food that I initially got introduced to, which back in the day when I was practicing and first came across it, was prescription only, was being reimbursed. It was a $400 a bottle. I brought it into my practice because I was like, wow, I have a natural solution with a published clinical data in humans that is safe, studied against ibuprofen and naproxen. These are the most common non-steroidal anti-inflammatories, and I could go prescribe these and people could get reimbursed. So this was my entree into it. Now it doesn't require a prescription. The price is a fraction. Used to be over $400 or so a bottle getting reimbursed. Now they're a tiny fraction, could sell it directly with a label requiring of physician supervision that people could talk to their physicians about. And many physicians now are getting on board with these natural solutions to pain and sleep and obesity.
So I heard this a couple times, published clinical studies, trials. I heard that a couple times from you. For our listeners at home, can you break down what that is and how that's important to what you're doing?
Sure. And again, if you look at the world of like how a medicine becomes a medicine and becomes a pharmaceutical and is allowed to get on the shelves or get a prescription and treat a disease, you have to do a human trial. You have to try these in a lot of people and compare it to a placebo, which is like a sugar pill, right? And say, look, it's statistically significant. It works in a lot more people than the placebo did. So there's a real effect. And you have to prove the safety, right? So, and you have to go through the FDA to get that approval process, right? So the medical foods, even though they don't have to go through the FDA and get approved because they're safe, they're regulated by the FDA, but they're allowed to make the claim. And the ones that I got introduced to actually did the human trials with humans compared to a pharmaceutical medication, showing in hundreds of patients a statistically significant difference on decreasing pain and inflammation, on improving sleep. Again, this is over 15 years, 40 million plus doses safely treating people with a number of conditions. And the published clinical trials are just scientific support that got put out in medical journals by prominent, at that point, the board and the doctors who did these studies are very prominent physicians on faculty at UCLA, big science backgrounds doing human trials.
Well, that's the way I guess it's done. So, if people at home need proof, realize, I guess, that whether they pay for the study, a big pharma company pays for a study done at a local college with a couple $1,000,000, or if it's done by an individual, third-party individual person and having their studies done, it makes a lot of sense for the future of this world to me that this would be a proper way to do all medicine.
Sure.
And in that way, it appears that it would be fair, a fair and just worthy way to offer You sign your Hippocratic oath, and you're actually offering something that you know is at least going to address the issue and is safe. Could we talk about some of these advantages of,
Yeah,
there's advantages of a pharmaceutical
sure.
uh, or a medical food? Could you
Yeah,
break
and
it down?
you hit on the most important word for me, which was safety. See, as a doctor, and again, I was traditionally trained. I was always into alternative and mind body and brought yoga and meditation and many things into my life, vibration, sound. I was doing that, learning from my patients in Los Angeles for many years. But everything in the traditional medical system, when I was writing prescriptions or someone's going for a surgery, you always have to do a risk benefit analysis. And it always, for me, started like, hey, if there's a safer option, I'm going to go with safety first, because you're always assessing safety versus risk. So any prescription you write, there's a risk. If I tell someone go take ibuprofen, I got to say, look, I know in 1,000 patients, there's a percentage of them who are going to have real problems with bleeding, with cardiac stuff, right? So the thing that attracted me most to this category was, wow, these are FDA regulated and they're perfectly safe. I don't even have to go through this 5-year process because the ingredients are all natural, right? So that was my main attraction initially, and I have clinical proof that these work. So when you talk about why, and we could go into each of the categories, like I was like, all right, this is consistent with my philosophy. I could always prescribe the pharmaceutical. And frankly, I was doing that initially. In other words, my people would come to me, let's say they had a sleep problem. They may be taking any of the prescription sleep meds like Ambien or tryptophan, Deserol, right? And I'd say, listen, I want to try this because it's perfectly safe. I have nothing to lose. And we'll start to add it on and slowly reduce your prescription medicine, because that is affecting your brain. It could be giving you side effects of confusion, daytime fatigue, addiction with your pain meds, with your sleep meds, right? Why not try a natural solution that has no risk to you? And if it works, will bring you down off your prescription medicine. And one of the studies showed, like with Theramine, the top pain medicine, it's a chronic pain and inflammation, right? It was studied against naproxen, which is Aleve, you may know the common name, right? And one study showed you could reduce the dose of the pharmaceutical med by 70% when combining it with the Theramine. And if you reduce your dose by 70% and get the same result of reduction of pain and inflammation, you are not completely, but eliminating like way more than 90% of the side effects when you bring down the dose of the pharmaceutical. Because in most pharmaceutical, your side effects are dose related. Like the more you take commonly, the bigger risk you're at, other than allergic side effects, which can happen in a very small dose. But if you're taking, 16 ibuprofens versus 2 a day, your risk of an ulcer, a bleeding, or cardiac is way higher. So many of these could be added right on to whatever you're doing, because they're amino acids that are producing neurotransmitters and balancing your body's natural healing abilities. And then you reduce the pharmaceutical. Many people, I got off them. But we all know with many of these problems like sleep and pain, the pharmaceutical options can be very, very concerning. We know about the opioid crisis for pain. You're going to hear more and more about the problems with nonsteroidal anti-inflammatories like the ibuprofens and the naproxens, causing problems chronically for people in their gastrointestinal and bleeding and kidney and heart. Well, here's a natural solution in Theramine that doesn't have any risk for you and could help you get off these and be a long-term solution. You could stay on these for life with no problems, no worried about what other drugs you're on. You could combine them. I had many people on the pain one, the sleep one, the obesity one, many people on all three. So this highlights a study, talking about elderly people who take these nonsteroidal anti-inflammatory meds. And this study shows incredible dangers. I mean, elderly people end up in an emergency room, and some of them die when they're on some of these anti-inflammatories for a long time. But even having to go to a doctor, having to go to a hospital because of the side effects, it really affects the healthcare system. And that's why I'm passionate. And when I came across these, my life mission became, I've got to bring these out to the public at an affordable price, not $400 a bottle, not worry about a prescription and the insurance. I just want to bring these out to help reduce chronic pain and inflammation and make them available to people. So this is a study with chronic low back pain patients using Theramine. It was a published study and showed reduction of inflammatory markers, which you'll see on the end of the study, like one of the major laboratory inflammatory markers is CRP, showed a considerable reduction. It showed reduction on all the pain scales with a natural solution as compared to, a potentially very toxic anti-inflammatory that is commonly used for people with chronic pain.
So these are the actual studies with the Theramine, and this is for chronic pain, joint pain, all
Yes.
types of pain. And it's
this is in one of the largest publications. It's called Practical Pain Management. It goes out to about 40,000+ pain practitioners in the actual medical field. And one of my colleagues from Cornell, who became a leading pain management doctor, he started bringing them in his practice. He had many people on opioids being referred to him, and he found great results with Theramine. He put this article out in one of the major pain publications about medical foods should be a first line treatment because they hold great promise safety in chronic pain. It's all about safety and efficacy. Efficacy meaning, the ability to have the effect, right? So these are safe. In many people, they will have the effect, but there's no risk and nothing to lose. Pain, sleep, obesity. We have Theramine. We have Centra PM for sleep, which also helps with depression. That was studied in a big study against trazodone. Now, trazodone is, that's the naproxen study for pain, but I think you have a sleep study as well there.
Yeah, the sleep study is right here.
Yeah, Centra PM. So trazodone is one of the most widely prescribed sleep medicines on earth. It comes in many brand names like Deseril. And this was a study showing Centra PM versus trazodone. And, look, Centra PM works on the nervous system, gives you an increased parasympathetic response, which is your relaxation response. It regulates that, again, by balancing neurotransmitters through amino acids and herbs, and lets you more naturally fall asleep quicker and have a restful sleep. Now, trazodone, I had many people on it could work, but there are many people who have many side effects that may be, especially long term, these things could affect, cognitive function, memory. You could get daytime fatigue, so many of the sleep.
About the difference in there. It looks like there's a comparison going on here, right? You're comparing the Centrum PM, a natural source medical food, versus a pharmaceutical, and just to bypass all the side effects, the addiction, using proven natural foods, you're able to prove that your claims, even though they might be equal, at least the side effects and safety are there. You don't get hooked on this, and there's buffers that they put in pharmaceuticals as well. As far as a natural component to all this, sleep, of course, is, who would have thought it could be a medical food, right?
Yeah, again, these are encapsulated, John. These come in, they're easy, they come in the form of a capsule, just like a supplement, just like a pharmaceutical often, but they're all natural, and we can make a claim, and they're safe, and they don't have side effects. And I just want to compare to the other world, which is supplements. I mean, many people take melatonin, for instance, or I mean, the bottom line is melatonin can't make a claim because it doesn't have the big science to back it up. And although it may be natural, it isn't regulated by the FDA. It doesn't have the manufacturing standard levels that we are able to have and make claims. And these are proven effective. And it's shown not to work in many cases long term. And now there's some concerns about side effects with melatonin, especially in a pediatric population.
Let's get through this, and then we'll go on to obesity. But sleep is so important. There's another trial that we're showing here about the amino acid preparation, unless you already covered that.
Yeah, I mean, again, it was against placebo, right? So like some people were given the amino acid preparation, Centra PM. Some were given sugar pills. This showed to safely make a big difference in getting to sleep quicker and having a smooth sleep. And then obesity is a great topic to transfer into because all these things tie together, like you say. They're all about, I'm about health and wellness and sleep. You don't have good sleep. You often could be snacking at night. There's a massive obesity problem. Both those things could contribute to chronic inflammation in the body and chronic pain. So here we have targeted nutritional approaches that will balance your body to help you address all these things. You clearly have to do lifestyle changes over time as well, right? With exercise and good sleep habits, right? And proper nutritional intake in your normal diet. But to have natural medicines that could target your neurotransmitters and balance them will really facilitate the lifestyle changes for a very, very holistic natural approach that I would use myself in any of these problems, right? As opposed to some of the meds in obesity, man, they're real serious meds and they could cause cardiac hypertensive effects with your blood pressure. And, sleep's super important. We're learning more and more about it. But, obesity is very, very dangerous, right? But the meds can be very dangerous themselves. And to have a natural approach to obesity, to really what the medical food we use, which is called Aptrim, does, and the study showed it, is again by regulating certain amino acids and producing proper levels of serotonin, which is going to balance your mood, and that's going to affect your ability to have an appetite suppressant. So Aptrim falls in the category of a natural appetite suppressant. It does that by working with the amino acids, regulating these signaling molecules, these neurotransmitters in your brain to suppress your appetite and manage obesity by having less of an appetite. Clearly, you have to be getting proper movement and exercise. Clearly, you don't want to eat 6 Big Macs a day, right? You want to have less processed food. Like the lifestyle changes are imperative, but to have something that could assist you as a natural, safe appetite suppressant, letting your body regulate in having less of a drive for hunger is like, to me, with these medical foods, why wouldn't anyone with any of these symptoms try them? When we know they're safe, we can make claims, the manufacturing is high level standard, and they work on regulating your body, helping you heal. I'm all for all the high priority on lifestyle management in all these cases,
Let's talk about what you ingest in your body, right? Whether it's a Big Mac, whether it's a GMO, whether it's a pesticide that was infiltrated into our food system by means of just farming and that science that they're trying to push on everyone, right? All this stuff, it appears, just clogs us up. So someone that might say, hey, I only eat once a day and I'm just still obese, right? You've got people that are obese that really, a lot of them don't snack that much, and then what it appears is that their body is clogged up or needs to be detoxified,
Yes.
or a whole bunch of these things that where our listener at home may not be aware of. So bringing it back a step, the science of how they work, I think we covered a lot of the high end science is so valuable. But in layman's terms, for the person at home with a sleep problem or obesity issue or living with pain or know someone with pain, how does this science and how does this all work?
Okay, so we could they all of these nutritional medical foods, whether it's Aptrim for obesity, which is an appetite suppressant, whether it's Theramine, which is for chronic pain and inflammation, or whether it's Centra PM, which is for sleep disturbance and can help with some depression as well. What they're all doing is giving us these amino acids, right? Amino acids, we could get amino acids in food, right? But in these problems, it turns out that we're not getting enough because our neurotransmitters, which are balancing our nervous system and signaling the brain, the nervous system, they are the communication signaling molecules in the nervous system. They're deficient in these disease states. And what these medical foods are doing with the proper amino acids being provided, that you can't just get through eating them because it would be too much to eat. Gram quantities. These are microgram quantities through a patented technology, a messenger amino acid technology, producing neurotransmitters, bringing your body back into balance nutritionally so that it could naturally heal. Again, the body's the most incredible healing mechanism. So that's what the medical foods are: a natural, safe, effective, balancing the neurotransmitters of your nervous system with these amino acid precursors with a technology to let you heal these diseases naturally in conjunction with the lifestyle changes you should be making relative to diet, exercise, good sleep habits, movement. I hope that explained it, but I'm glad to, try to keep it fairly simple in terms of balance.
Yeah, that really helps. I always think, breaking the science down, medical doctor, advanced knowledge, someone at home that needs the benefit. So we covered high level clinical trials, studies, science on both sides.
Right.
So people could really grasp and get a hold of the power of what, Dr. Mike has put together.
And
And
again, oh, sorry.
yeah. I was just going to say, how do we find you, Dr. Mike? And, we talked about pharmaceuticals, which could be a copay, but also in the end, it seems like a system that this third party payer system, literally a pill that costs 1 penny for big pharma, they may charge $3, $4, $5,000 to your insurance, right?
Right.
The price, like, so if something is equally, if not equally or better in value and quality and performance, what's the price difference between what you're
I mean,
offering?
these used to be, when they were prescription, they were priced at approximately $400 a bottle. I mean, now they're retailing at $59.95, because, as you know, I acquired this company because I wanted to bring these out at a large scale, don't have to go through prescription, still need physician supervision. But again, you could buy them directly, I believe now off your website at $59.95, which is dramatically different from where they used to be. And again, these are, we have them for fatigue, for cognitive decline, for chronic pain and inflammation, for sleep, for obesity, for neuropathy. I have a large variety of medical foods, and they're available on your website. We also have medicalfoods.com, which we'll give you a code for that, if people want to learn more about the products, medicalfoods.com will, give them access to all the articles, the science, the history. There's videos on that. And I can be reached at Dr. Mike at medicalfoods.com, and glad to dive in. And, I would encourage anyone who talks to their doctor about them, because their doctor may have osteoarthritis. We have them for osteoarthritis too, and joint disorders. We have Tretpidone. We have Centra AM that many people replace coffee with. That works for cognitive decline and fatigue. I encourage you to have your doctors take a look at the science and reach out to me, because, my mission is certainly to get practitioners educated in this and be partners in recommending these natural, safe solutions to you that have good data, and be a partner in helping you maybe reduce some of your pharmaceutical medications as they bring you on with the medical foods, and hopefully have a safer option for you. Well, this is a mission for me. I've had many people taking these for many years, and many practitioners around the nation who've had success with many patients. And as I say, my main thing is these are safe. There's good data that they're effective. They're not a miracle for everyone. They'll work for quite a number of people, just like any drug will. The superior to supplements in that the science is very strong and the manufacturing is very high standard, and we can make disease claims as we're regulated by the FDA. And, I hope you can consider using these to help combat some of these chronic conditions while you're making the appropriate lifestyle changes, which are critical. And love to communicate, educate you, clearly educate your doctors, because we want more and more practitioners, whatever, holistic, traditional. I'm available to communicate and educate any practitioner on how to bring these into their practice. So thank you, John, for the opportunity. Yeah, glad to be available anytime to come back.
Well, I put the link in the description, whether you're on Rumble, Facebook, so be it. Look in your description. You should see it. It is on antiagingbed.com under supplements. I'd like to pull up the 3 things that we talked about today: pain, sleep, and obesity. And I'd like to share those different products. I'm going to share my screen right now so you at home have more information to know exactly which products can help you do what. So I'm going to go to these supplements. We only have one supplement page, but all of our supplements are there. For instance, we've got the Centra PM, and it is $59 right now, and that is a special. Typically, it's $79.95. This Centra PM, I know we covered it, but could you give a rundown of each product, because we got 5 minutes left, Dr.
Sure.
Mike?
Okay. Yeah. And again, although I know you have them listed as supplements, the big distinction is they're medical foods technically, which I know is a strange name because people think of a shake or a bar, but they're encapsulated products. So Centra PM, again, helps with sleep, especially chronic sleep and depression, right? And again, it's going to balance things like your GABA, your serotonin levels, right? Like the neurotransmitters in your brain that are very critical in sleep. GABA is the main inhibitory. It slows things down. This helps regulate your, it's called your sympathetic nervous system, which is your parasympathetic response. And again, it's been studied head to head against one of the most widely prescribed prescription sleep meds on earth, showing that it's safe, it's efficacious, it'll get you to sleep faster, hopefully, and have a restful sleep. So that's Centra PM.
Okay, we got Theramine. It looks like this is one of the top products that we have here.
Theramine is the one that has, again, this one has had over 30 million doses prescribed for over a dozen years successfully, and was the most common one I used because I did a lot of pain management. It was for chronic pain and inflammation, which is endemic. So Theramine, again, is bringing these amino acids to balance neurotransmitters, which will let your body heal naturally and will dampen the signals of pain. So when pain comes in, it's going through your spinal cord up to your brain, and that's regulated by your nervous system. So Theramine is with the neurotransmitters it's producing that are deficient, it's dampening that response to pain. It's lowering the pain signaling.
So as a professor and a acknowledged and recognized back spinal expert, this one of your top sellers?
Yes, this is number one because chronic back pain and inflammation, neck, back works for any pain and inflammation. I mean, I've used it on a chronic tendonitis I had once, but like chronic back pain, chronic neck pain, even people with headaches take it. But I do say give these things a month or so to work though, because again, they're nutritional. So you want to wait a month, 6 weeks because you're bringing the neurotransmitters up to balance them. It's not like a pharmaceutical med, which can be dangerous. It's safe. Those you could take in one day and feel the effect, but you feel the risk of the side effect. Let's say you feel it, but the risk of the side effect is there. These you have to give some time to bring the levels of the neurotransmitter up. So that's very important to give these things a month or two to work. And you could stay on them forever, and you could be on a few of them and they could be combined with no dangers because they're nutritional based amino acids.
They say the average medical doctor only has four hours of nutritional study.
Well, yeah, I think that, 4 seems like a lot these days. It was 1 hour at best when I went to medical school.
Right. And so the tables have turned, the people have spoken, things like this, and people like you sticking to the path to better people's health. One of the last ones I'd like to talk about, only a couple minutes left, is the weight loss.
Yeah, of course. I mean, Aptrim's great because it suppresses appetite in a natural way, right? We have both Aptrim and Aptrim D. One has caffeine, one doesn't. Could use either one. Again, a lot of obesity is a brain gut relationship, but it's related often to your mood, eating. So if your appetite is decreased because your brain is balanced with the right neurotransmitters, and you address your cravings, right, and that need to eat to feel a better mood. Now we have something that could bring your serotonin levels up and regulate your nervous system in a way that you'll have less cravings, less of an appetite, and thereby when you're exercising and you're watching your diet, you'll have less of those tendencies to binge eat and do a number of things that lead to obesity, which is very, very dangerous in our society and prevalent.
Yeah, so we've got a couple minutes here to run down. I just felt that it was just amazing, all the information you shared on the show today, different products, the different citations, clinical trials, but most importantly, this puts the power back into regular everyday people by being able to control your own health, have a system that's proven equally to the current system, right? And having people like you on my show is just amazing. I learned a lot today in regards to this new category of supplementation. Any last comments here before we go? We've got like a minute left on the air.
Yeah, just, I'm grateful. I think the whole movement of people being educated and having just alternative options. I mean, look, medicine could be great, and there's certain pharmaceuticals that are necessary, but when you have a safe option that has good science behind it, my goal is to bring real science to nutritional medicine, and food is medicine. And we now have an ability with these encapsulated medical foods to bring strong science to empower people to heal naturally.
Well said, Dr. Mike. Well, that's all we have for today. The show is up. Catch me next time at 10 p.m. Friday, Eastern time on the Patriot Party News. Proud network. Very proud. We don't have the censorship like other networks, and this is the last foothold of censor-free information like the information we gave you today. So thank you guys very much. Until next time, thank you, Dr. Mike, and everyone at home. Appreciate it.
Thank you, John.